much. Good evening, everyone. I trust you had a productive day. I'm excited to be here. When I was told to pick something to talk about, this was what just came to mind, and I think it's a very, very important topic. With quality improvement, I first heard about quality improvement in healthcare as a house officer. Never heard about it as a medical student. So it was towards the end of house job that one of my mentors, you know, had asked me, "Have you heard about quality improvement in healthcare?" And he sort of, like say, held my hand and began to show me resources. And I think it's something very important if you're working in healthcare, regardless of your discipline, whether as a doctor, a nurse, or just even in management. I think some of the things that would be shared are actually applicable other in other fields. So I will just share my slides so that we can, you know, all look at it together. Okay. All right. Okay, so I'm going to talk a bit about what healthcare quality improvement is. I'm going to just a bit about myself first of all. I'm a senior registrar in the Department of Paediatrics. I basically see patients as little as 600 grams to kids as old as 16 years, and I've been doing that for about 5 years now. So beyond that, I've always had interest in quality improvement, and I look for ways in my own environment to improve the quality of service. So a few things we'll talk about today. We'll talk about, what QI is, or quality improvement is in healthcare. We'll talk about domains, a bit on the importance, some of the tools we use, and just what the role that each person plays in, healthcare quality improvement. So the world over, there's a demand for safe, effective, and equitable care. I think if we look at data from countries like the United States, a lot has been done to improve patient care. There was a time when there were a lot of preventable deaths that was related to maybe human errors in the workplace and just systems not working as they should. And it's very different from quality assurance, which I would still talk about. So quality improvement is not the same thing as quality assurance. Quality assurance tends to look at products or maybe services and if it's meeting a certain standard, whereas quality improvement seeks to continually improve on a process or a system, and it's foundational for the performance of every system. I mean, I've been in healthcare for a while, and one of the challenges we've had in the past is what some people would term shame and blame. So when there is an adverse outcome or when there is a problem, the tendency is to, pick out a person, okay, what did you not do or what didn't you do? And we forget to look at the system as a whole. So healthcare quality improvement is shifting focus from one person to how we can make a system effective, how we can make a system safe for those who are accessing care. And also and what quality improvement now does is to identify all the key stakeholders. So it's not just about the physician or the nurse, but the patient too is important in whatever care is being provided. So quality improvement, it's the systematic data-driven efforts. I highlighted data-driven efforts because data is paramount in healthcare quality improvement. If you're going to move from point A to point B, what's your baseline and how do you track that you have improved? So data is very important when it comes to healthcare quality improvement. So these efforts would enhance patient care processes and outcomes, and it involves continuous measurable initiatives to close the gap between current practice and optimal care. So as healthcare professionals or even in whatever field you find yourself, you have existing evidence that 1, 2, 3, 4 would give a desired outcome. But are you seeing that in your facility? Are you seeing an improvement in, or improvement in infection rates? Or are you seeing that wait times have reduced? So beyond, what the current practice is and what's, the data tells us, can we say that we have been able to implement that in our, spheres? And I think it's very important. I like to think that, yes, the healthcare system on a larger scale leaves a lot to be desired, and there are many gaps. But I believe that if you have the opportunity to lead a team, or let's say manage a hospital, manage a clinic, there are still things you can do to improve the quality of care, even in that sphere. And so, whilst we expect things on a national or state level to be done, I believe that facilities can, have a system that is still effective, that is safe, and still, meets the needs of patients who are accessing care. So quality improvement, quality assurance are very different, like I mentioned earlier. So quality assurance would focus on products, services. They may employ tools like checklists. They have documentations which they look at after an event or after an intervention has been done. Whereas quality improvement is looking at systems, and systems involve a lot of things. So systems involve the patient, the doctor, the nurse, even the whatever form of, you look at your systems, you look at your processes, and what's the interplay, and is there, cohesion in how these things work. Quality improvement, again, it's continuous. You're constantly improving, you're constantly monitoring, you're constantly tracking whatever, intervention or outcome you're expecting. And there are several tools which I'll talk about as we move on, such as root cause analysis, the PDSA cycle, Six Sigma, and others. So according to the Institute of Medicine, there are 6 domains of quality that are important. So when you want to assess that the care you are receiving is quality, you're looking at whether it's safe. So, and safety on its own is a broad thing entirely. You look at patient safety, organizational safety. So you want to avoid harm. Is it effective? So are you using evidence-based, is the care you're providing evidence-based? Is it patient-centered? And it's very important that the care we provide is patient-centered, especially if you want to ensure there is adherence to whatever management you give. It's important that the patient is, involved in the care. And patient-centeredness would also expand into communication. So as a healthcare provider, when you are prescribing or giving information, it's important that the patient understands, because that helps, adherence to whatever treatment you give. You also want care that is timely, efficient, where waste is avoided, equitable. So you want to ensure that, there is access for all people. And it's important because quality improvements over the years has helped to and continues to help to improve safety and patient outcomes. It enhances efficiency, it reduces costs. It promotes teamwork and learning, and one of the things that's important is evidence-based practice. This still comes back to the importance of data when it comes to quality improvement. I want to highlight the last point, which is that it builds a culture of improvement. One thing that is very important when we talk about quality improvement in healthcare is that we want everyone to have that culture. So for one, I believe strongly that quality improvement should be a part of the medical curriculum. I don't think it's something that should be left for whoever is interested. So we want a culture of improvement so that as a physician, as a nurse, as a physiotherapist, okay, you're able to track the quality of service you've provided, say, over 6 months. So are your processes, improving outcome? Are you having more hospitalizations with your current process? Do you need to, do you need to improve here, adjust there? So once there's a culture of improvement, it's easier to effect change. Still talking about culture of improvement, we are still trying in some sectors to build a culture of data collection, data analysis. It shouldn't be for a select few. So some people are yet to really grasp the importance of having data, because and data is very useful in decision making. So building that culture is extremely important. I'm just this slide just highlights a few tools that are used in healthcare quality improvement. So there's the PDSA cycle. I'll still touch on it briefly. Lean methodology, Six Sigma, root cause analysis, clinical audits, and depending on your facility and the amount of knowledge that the QI team may have, they may employ several of these tools. Some they do offer similar outcomes, because the aim of all of this is to improve the service you're giving, is to improve the quality. So some may focus more on reducing waste, some may focus on ensuring that whatever outcomes we get are well monitored. I'll highlight briefly the lean methodology. So lean methodology, I know we have different people on this call, and I won't be surprised if some of us have heard about lean methodology. It's something that is also applied in manufacturing, and the aim really of lean methodology is looking at ways to eliminate waste in a system. Are there ways is it possible to reduce a 4-step process to a 2-step process and still get the same outcome? So that's where lean methodology comes in. And in healthcare, one common example is in patient flow. So if a woman has given birth and is meant to come back for a postpartum visit, can the system be modified in such a way that the time she comes for her visit is the same time that the child is meant to have their own checkup? So that too would reduce wait time, and would reduce the hospital visits that this mother may have to make. And again, this even still ties to patient-centeredness, because you want them to be as involved, and you're also trying to help the patient have the best experience possible while receiving care. There's also Six Sigma root cause analysis, which we'll talk about. Clinical audits. For a lot of public health, there's a lot of public facilities, clinical audits are done, and it typically takes the format of the morbidity and mortality statistics. So we gather as physicians, and we talk about an adverse outcome, what are the lessons, what are the gaps. So it's done to an extent, but I believe that there is still a lot more to be desired, especially when it comes to data. So one of the things and one of the gaps I have noticed is that beyond these audits, we don't necessarily measure. So we talk about what's the percentage mortality that was recorded over a 1-year period. Are we able to identify the things that contributed to that? Then we now profile solution. So if we have more checklists here and there, are we able to reduce the mortality from a certain percentage to another one? So it's really important that more and more people are mindful or are aware of the importance of data when it comes to improving on a system or improving a process. So I'll highlight a few tools. That's what we call the PDSA cycle. So the PDSA cycle is we talk about plan, do, study, and act. And this is a continuous cycle where there is iteration going on over and over and over again. And this PDSA cycle, so it starts with the plan. You notice there's a problem, and this is not just applicable to healthcare. So there's a problem that has been noticed, and you propose a change idea, and you have an outcome. So you now want to talk about how do you implement, and how do you monitor, how do you track your implementation. Based on that, the data you have, are you able to, you know, does it match what you predicted would happen? If it doesn't match, what's your next line of action? The next line of action could be to, change, modify the outcome and begin a new PDSA cycle. It could be to adopt what has worked and still monitor. So you're constantly looking at how to improve on a system. So that is very important when it comes to healthcare quality improvement. Another tool that is important is what we call the root cause analysis, or RCA. So usually when we talk about root cause analysis, we are looking at cause and effect. Like I said earlier, for the longest time, it was a shame and blame thing where you were, oh, this thing happened and this person is to blame. But we forget that several factors come into play. Now, I'll give the example of delay in getting lab results. So a test has been ordered, but it's taking, a test that should have a turnover time of 2 hours is taking 2 days. Now, a root cause analysis, usually we use a fishbone diagram to talk about the root cause analysis, and we're looking at the people involved, the environment, the materials, the equipment. How do these things contribute to the delay? So I imagine that a patient is seen, they're asked to do a test. Now, depending on how this was communicated, that can even affect the patient's, let's say, attitude towards getting the test done. So that can be an issue. Now, in being asked to do the test, is it possible that we have maybe fewer phlebotomists? Phlebotomists are the people who would draw blood and take the sample. So do we have enough people on ground to cater for the patient load? So that can also cause a delay. Now, in some centers, it's the patient that has to do the transport of their samples from one point to the next. So all these things can cause delays. Do we have enough sample bottles and reagents? If we are running our tests, are we running it in batches? When do we have more, of a particular test to run? So all these things actually play out in how soon a test result comes out. So if a test result is available, when is it vetted? What's the system for it to be vetted? If we have fewer staff on ground, is it possible? Do we have a checklist that can help to vet when there's no body per se around to do that? So all these things are important in looking at the cause of a particular adverse event. I remember an incident that happened at work where a young boy who was diabetic came into the hospital. He came in an emergency, and usually with diabetes as an emergency, we give insulin. Insulin now has to be stored at a certain temperature. Now, so he brings his own insulin from his house, where we couldn't really ascertain how this insulin was stored, at what temperature, is it still viable, and all of those things. So there were no safety measures or checks in place to say if someone is coming in with insulin from wherever, how do we, ensure that it's still potent and useful? So when this patient comes in, the insulin they brought from outside was what was used to treat initially, and we noticed that we're not getting the desired outcome. And so we had to take a step back to look to troubleshoot, in a sense, to say, why are we not getting desired outcome? And in further probing, we found, okay, this insulin may have come from the house. There's the challenge of power, like electricity, so we can't even vouch for the integrity of that. And we realized that once we were able to get insulin from our pharmacy, that's the hospital pharmacy, we began to see an improvement in the patient's clinical state. Because for us in the hospital, one of the things that has been ensured is that there's always power supply. So you know that if you're storing a drug at a certain temperature, it actually remains at that temperature. And so that is that is where a root cause analysis comes up. And if you look at the picture here, it's more looks like a fish bone, and you have to now look at all the things that affect the outcome or that leads to that effect. So there are several causes within a system that can cause an adverse outcome. But if we don't sit down to analyze these things, then we're unable to actually improve on the system. So in that kind of situation, like the story about the boy who had diabetes, it's easy for someone to come and say, oh, the doctor that was working was not mindful. But another approach could be that, one, why don't we have a standard protocol that says, regardless of who comes in, once they come in with insulin from outside, because there's so many factors, you use the one that is provided in the hospital where you know that the environment is actually controlled. So if you have such protocols and policies in place, it even reduces how much conversation you would have with the caregivers of the child about, was this insulin stored well? Are you sure? Do you have electricity all the time? And all of those things. So if such things are in place, they actually help to improve patient outcomes. Another important tool is what we call the Six Sigma framework. And what happens with Six Sigma is that it's still a tool that helps with improvement. And one of the first thing you want to do, so we talk about the DMAC framework, where you define a problem and you set specific goals. Over time, you want to measure, you're collecting data. So if you've noticed, one thing that has been recurring is how important data is throughout the whole improvement process. So you're collecting data on the process to understand, are we performing as we should? You collect this data, you analyze this data to know where are there lapses, where are there inefficiencies, and where can we improve. So there's the importance of having this feedback loop helps to ensure that our services are better and better. And when it comes to control, you monitor the process and ensure that whatever improvement you're seeing is sustained. And I think these are things that, regardless of where you work, you can always implement small changes. So yes, it's easy to talk about on a larger scale the inefficiencies across the things we're yet to get right. But I believe that if you happen to run a unit, run a small group, like manage maybe a small hospital, a unit, a department, there are little things you can do to improve the service you're giving. And when we look at what is being done, there are just a few steps. So majorly what you're doing is that you identify the problem, you collect data. So what could the problem be? The wait time when a patient comes in is 1 hour, and then there's still the delay at the lab. So you have to now collect that data to say how many patients actually get seen within 1 hour, or how many patients get seen after 1 hour, and for what can be done. And so with that sort of mindset, you're able to make changes, or let's say proffer solutions. And as you proffer those solutions, you're also monitoring. So has the wait time reduced from 1 hour to 30 minutes? How did we achieve that? I look at, even, okay, sometimes the challenge we have is wait times. So, and you look at the type of cases. Is it possible that some people are seen via like a virtual, some people have a virtual consultation, so that they're not coming to the hospital to wait for something that could have been solved? And this is now like for an outpatient basis, because at times the patient you're seeing, the the management you're giving may just really border on counseling and reassurance, and may not require you to prescribe a medication. There are some that may require that. So is it possible to have some patients who are seen, like, or even let's talk about maybe you're coming to review results. Can the results be reviewed virtually? and at a fixed time. So you're not just coming in and you're waiting 3 hours to spend 2 minutes. So those are things that you begin to, will I say, think about and look at how to improve and how to sustain that improvement. There's several challenges that have been encountered, when it comes to quality improvement, and it's important to, okay, so we talk about challenges and we talk about enablers. Leadership is extremely important. If there is no buy-in and the vision isn't cast for the team, it's difficult to sustain this. I remember I spoke about the importance of that culture of quality improvement. So the team involves everybody: doctors, nurses, lab scientists, physiotherapists, the record staff. So what's the communication about quality improvement? Do we see it as important? Do we see data as important, so that even after you've done whatever work is required, you realize that data management or data entry is also an important part of what you do as a healthcare professional? So leadership is very important, training as well. So there are times that the leadership may have an idea of the importance of quality improvement, but are the other people being trained? Because as a leader, you would not be in three places at the same time. But you want to ensure that people you're working with have bought into the idea, have come to have understand why it's important for us to collect data, analyze data, monitor, track, and constantly improve on a system or the services we are providing. So, and then teamwork, because the team in a hospital comprises of different people, and everybody has a part to play. So that if someone even happens to see, there'll be a piece of paper that contains some vital information, the person will not just discard it. This could be useful. So it's really important that everyone comes to that mindset. Now, I also talked about strong data systems. Well, I would say in the past 3, 4, 5 years, a lot of hospitals have employed electronic medical records, which I think is such a fantastic idea. I mean, we could do better. I wish we had a unified, record system, but regardless of that, it's good to see that hospitals have an electronic medical record system, because that helps with data entry and data collection. There are times when you're trying to track the admissions and discharges you've had over a period of time, and it's written in a book that sometimes gets lost or is damaged by water, or something happens and you're not able to get that information, and you're now just you don't even have a baseline data to work with to say this is where we are and this is where we're going to. So that is one thing that would help when it comes to quality improvement. So if you have an electronic medical record system in your facility, you can look at what's the trend of diseases over the last 6 months. Are we seeing, like, what's the age group affected by these diseases, and what has been the intervention? Where have we seen, has this intervention led to rehospitalizations, or have these interventions led to these people being discharged from a particular clinic? So you begin to track all these things. But some of the challenges that are faced now is in terms of limited resources, because yes, we want every healthcare professional to be involved, but we also have to consider having, let's call them, for lack of a better term, now let me say data scientists that also come in to help, because at times I need not mention the doctor-patient ratio and the burden of number of patients, a doctor may have to care for, or not, or a nurse may have to care for. We know about the massive brain drain that has happened over the years. So yes, there are limited resources. There are places where tasks are being shifted, where things that what may have been considered traditionally a doctor's role is being moved to is being given to other healthcare professionals to do. So we have to see how to work with the available resources and look at other things that could be automated. So those are the things that can affect how much people do when it comes to healthcare quality improvement. Sometimes there's resistance. So resistance could be maybe due to biases or just
Hello, I think there is a problem with the network connection. Dr. Minka, are you still with us?
yes, I am so sorry about that.
Great. Welcome
Okay,
back.
thank you. I'll share my screen again. Okay. Okay, so I think I touched on the enablers and the challenges. So again, the challenge again is data. If we're going to improve, we need to have a baseline. Where are we starting from? Where are we going to? And the truth about it is that data has to be entered. I say that because at times in my field it can be a very daunting task that you have to sit down and just input here and there. But that's the only way we're able to make sense of whatever information, we're able to make sense of the system we have. Where are the gaps? What do we do? But if we don't even have the data, we're unable to solve the problem because the data is what would show us the problem and even give us an idea of the magnitude of the problem. And with that, we continue to iterate as we move along and we, you know, get to a point where we have a much better system. So QI is something that is very important, and I do know that there are a few hospitals that have employed some form of quality improvement in the service they provide. So I know of a few private hospitals that once there's an adverse outcome, they sit down as a team and they do a root cause analysis. So to figure out, okay, what is the problem, where are the gaps, and how can we improve them. So digital health, for one, I think would definitely is definitely the future, where it's easier to collate data, easier to, if let's say, collate, yes, aggregate data and make sense out of it. And eventually we would get to a point where we even employ artificial intelligence in how we monitor whatever intervention we're giving. I mean, for those of us who use ChatGPT and other AI tools at one point in time, you realize that the more data you feed it, the more it sort of improves on the kind of feedback you get. So that would also be useful in, quality improvement. And we want a situation where, as much as there are gaps, is it possible that subsequently in Nigeria, the quality benchmarks that we have is at par with what is, obtainable globally, and also value-based and patient-centered care. It's extremely important that the patient is as involved in the care as possible, that they are aware. They have to be aware of whatever care is being provided, and know where there are gaps and what they can do. So a few things that I would just highlight as I round up. this actually is just like a brief overview. There's a lot that can be said around quality improvement, and there's so much more to be discussed. But I would say these things that are very important. One, it's continuous and it's data driven. So we cannot overemphasize the importance of collecting data to understand our system, understand the gaps, and know how to improve on it. And when we judge that the system is providing quality care, we are saying that the care is safe, it's effective, it's patient-centered, it's timely, it's efficient, and it's equitable. And everyone plays a role. Everyone has a part to play in the care that the patient receives. And ultimately, we want a situation where the patient is better, the care they receive is better. So with that, I would just, implore us, if you're in healthcare on this call, it's something to think about, something to read more about, and maybe in your own space, look at what can I make, how do I make use of the data I have available? How do I care whatever service I'm providing, and how do I improve on it per time? That is what quality improvement really is about. And like I said, and I would stress it again, I think this should be taught across board from medical school. Everybody should be involved, and that culture of improvement should be something that is cultivated across board. So I have a few references here, and thank you.
Thank you very much for your presentation. All right, the floor is open for questions and comments. If you want a copy of the presentation and access to the recording, please put your email in the chat. We will have it sent across to you. All right, so platform is open. There's a question. Okay, feel free to unmute.
Hello, good evening. My
Good
name
evening.
is
Good evening.
So I'd like to ask, you've asked for doctors, health professionals to carry out the extra task of filling in data. What benefits is it for them personally? Because from human nature, if you tell someone to do something just because the other person benefits, and I get to do extra work without a commensurate benefit on my part, why should I do it?
Okay, thank you for that question. So I think the first thing I want to address is that ideally, data entry is something that is part of what is done as a healthcare professional. Unfortunately, for the longest time, it hasn't been something that has been in our consciousness as doctors or healthcare professionals, that your work is not just in your interaction with patients. Your work is also in how that like is interaction with the environment and what you do with the evidence that you have. So the evidence, the the way you get to provide evidence is by data. So unfortunately, that hasn't been the mindset. That over time now, when you talk about data, the first thing someone asks is, what's in it for me? But ideally, you're working in a space where you are providing a service. You should be concerned about the impact of your service. Is it really improving? So the data also even helps you as a professional to know that whatever service you're providing is actually useful, is actually leading to a desired outcome. So as a healthcare professional, you should be keen about improving on the kind of service that you provide as a doctor. Yeah. Thank you.
Good evening.
Good evening.
Dr. Minka, okay, so I'm not in the medical line, but I just came in at about 5:20 something, and you were talking about digital, medical, whatever. I want to ask, where is Nigeria headed when it comes to having data as basic as blood samples, because when you talk about a crime scene, for instance, and you want to get maybe tidbits from the criminal, maybe hair and all of those things, we don't have such data. What is the medical profession doing about getting the data of Nigerians in the system so that you are able to trace somebody through maybe something that relates with them? I don't know if you get what I'm trying to say.
I do.
This may not relate with you directly, but I'm asking John because I believe there are other medical personnel in the house. Where are we headed? When do we start to collate this data of Nigerians that will help us not just for criminal cases, but in so many other areas? Because you're talking digital data here.
Okay, thank you very much for that question. It's a very important question, and I can't tell you. So, how do I put this now? There are several groups of people who maybe like in private sector who are able to collate data, like when it comes to say human genetics. There was Gene 54, a startup at a point that had data on like genetic material for Nigerians at a point. So the thing with data is, again, it goes back to that culture. So first it starts with the mindset of, is this important enough? And then do we have policies to support us getting such data? Apart from policy, do we have the resources? Because to set up an infrastructure to mine data or to collect data is also capital intensive. And that's not going to come from the pocket of a doctor, or that would be something that perhaps is funded by a large body, even the government, or a large enterprise that is committed to seeing how we can collect that data. So first things first is the mindset. And the truth is, there attendant that like there's several health problems, and I believe that with every person who comes in, they tend to focus on, let's solve this one first. Let's see how we can get our primary healthcare centers working before we even talk about genetics or gathering data. So mindset shift first, and people seeing the importance. You talked about, when you watch all these forensic shows, it's there that, so you can see that in that setting, the police have some form of data collection where if a person commits whatever crime, they now get their data and put it in the system. But we have done something in terms of, like, if you look at biometrics now, that is some sort of data that has been collected, whether it's in your BVN, NIN, IPPIS payment platform. So we have that data as a start. There's still so much more we can do, but that is one place we have come. And so I think, one, changing the consciousness and getting people to understand how important it is the first place to start. And if you can change that consciousness, and people are willing to put in their money or put in resources to ensure that we're able to collect this data and use it. Thank you.
Thank you very much.
We still have room for more questions. Yes, you can unmute Usiwoma.
Hello. Thank you for the
Hi.
wonderful presentation. It's very great, and glad to know about what's happening, and I'm also aware of the Gene 54. Yeah, excellent.
54.
So I think there were some things you said which it's good. So over here in, let me just put it in the West, when we do quality improvement, it's kind of like compulsory or obligatory.
Okay.
Every medical practitioner must do a number of that for you to sustain your license. If not, it's taken. So, and I know someone asked a question like, what do I get? So it's let's say you get you being able to renew your license, but just like what you explained, it's part of the work of you taking care of your patient. It's like when we're talking about a mechanic, their job is repairing the car, or an engineer. So ours is treating patients. And for us to treat a patient, there were times where they used the cutlass to do cesarean section, and then people sat down. Then there was nothing called AI or data, but the main thing was they knew many people are dying from this process. How do we make it better? And something also that it well, I say, I don't know where to place it, is that Nigeria, we're still trying to catch up with other people, but the people that we will say have caught up or they are on time, they are still the ones that take this quality improvement very serious. So it's something that I think we have to put in more effort. We have lots of lags. We have patients dying for preventable causes, not something beyond us. We've not yet talked of research. So it's something that we have to keep to that standard where every doctor is on ground on that. And something I would like to ask, because I think this would be related to the willpower. Like you said, there is the role of the government. It involves finance, and also it's something not all people like data being given out, because when we talk of so I think that's kind of like a challenge, which I would like you to throw more light on challenges in achieving quality improvement, because it's not only on even admission or discharge, it's on anything not working well. And um, it's giving people the liberty. So I can be a house officer and I just notice pregnant women die or this thing is not functioning. I have the right to pick on that and find out why. And these are some of the things, um, not just only in the medical field, in the country, people want to hide. There is a one of, okay, to keep our name or different things, and it's not really helping every sector of government or of Nigeria, not just health. So apart from it's a really, or I would like you to throw more light on the willpower of both the medical leaders, I mean, like the head of the hospitals, the managers, and also the government, if they are willing um, to work on we getting data, we compiling data, because I know we have engineers here. If they want to do this thing, you just have to pay the engineers. It's not really not all the work are for the doctors to do. You pay the engineers and you put it as part of your system. So they do part of the programming, you do your own part. So if you could talk more on maybe your experience on the willpower from the government to finance and also from the manager, because I'm just thinking if Abuja is at this level, which I know, then that means, which I already know, the whole country needs a serious upgrade. So you can take over from here. Thank you.
Okay. Thank you very much for your feedback. So one of the things I mentioned earlier was the what I talked about enablers and challenges, and leadership is very important. I don't know how we can generate willpower, but I believe that good leadership would go a long way, like in encouraging people to take this seriously. And I'll share an example. The first time I found out about quality improvement was from my consultant, and it happened. I was working in the special care baby unit, and I noticed there was some information that was being passed around, but it wasn't well presented. It could have been lost, and I found a way to just put it together and have it available for people. So when he noticed that, he now was talking to me about, oh, quality improvement. How do you maybe curate information that is easy for people to use? And that was a guide for me. And when I moved to like where I am now doing my residency, one of the challenges we had at a point was that we were storing data, going back to admissions and discharges in books. So we decided to create a Google form and collect data. So this was even easier to retrieve, easier to analyze. We could easily study trends to see how our admissions had been and the kind of care, was being that was being received. But the point I just want to stress when it comes to willpower, I believe it still boils down to leadership. So, does the leadership understand how important it is? Do they and are they able to not even communicate that to those who they're working with? Like in America, there was I think in the early 2000s, they were having up to over 1 million preventable deaths that were due to either medical errors, human errors, and that was part of what was used to make a case for how do we improve the system? How do we ensure that human errors are reduced as much as possible, or we have enough checks to ensure that if somebody misses this error, someone else won't miss it. So I believe strongly that having good leadership, having leadership that is mindful of, how important this is. And one place that I know that has done fantastic when it comes to quality improvement is Federal Medical Center Ebutemeta, where they make sure they have improvement projects and they monitor to see how they are improving in the services that they are providing. So that's just it. I think leadership has a strong role to play in casting the vision and letting the staff and all stakeholders see how important and how needful it is that we are involved in quality improvement. We are mindful of the data, the data that is available, because you mentioned a house officer. So if the house officer wants to take on an improvement project now, it may be a challenge if and you know how medicine is and hierarchy. He will probably face a lot of challenges from even senior colleagues, like, what are you trying to do? But if the leadership sees how important it is that we improve in our services or improve in whatever it is we're doing, then he even has that support to carry out an improvement project and see that the services they render is better than what it was. Thank you.
Okay, thank you. So, yeah, the willpower still needs help. And I think also making policies to enforce that above once it's kind of like in a form of policy, then it's kind of like a government order. Like everybody has right to run an audit or an improvement process
Yeah.
without much restriction from those above. Yeah. So I think those
Yeah.
are things we can work on to improve quality improvement. Thank you.
Thank you. And just even on just to add, like, policies are really important. And I remember reading through Nigeria's health policy, fantastic stuff. And but now the challenge again sometimes with policy is that how do you bridge the gap between policy and implementation? You could have a nice written directive on paper and you want 1, 2, 3, 4 to be done, it's mandated. But unfortunately, there's still the challenge of it not being implemented sometimes, or most times. And so that now becomes a hindrance to these things being effected. So it's only in spaces where leadership is ensuring that this thing has been enforced, or is ensuring that whatever policies are being implemented by as much as possible. Thank you. There's another hand up. Please go ahead.
Okay. Yeah, you touch on a very salient point, which is mindset. So the NMA is a pressure group. And the issues we are discussing here today are not things that Dr. Minka or any other medical personnel as an individual would be able to handle. But let's look at your generation of medical practitioners. you are is it the Gen Z or whatever they call them? The way you people approach medical practice is different from the old generation. Can we have a situation where your generation of doctors come up with a referendum or something in your forums and begin to push from the base going up through the NMA leadership to who is the Minister of Health, then onto, it has to go level by level. It's not something that we may achieve in 3 years or 4 years or even 10. But let's just start somewhere to say, yes, you talked about policy and then the problem of implementation. It's not only medical field, it's a Nigerian problem. But let's believe that it's doable. We can't keep seeing the problem every day and there's no solution to it. So let's start from the lowest level of your small group discussions to your association meetings. We start this thing, we push it forward. Then there's a bill moved. It just takes stage by stage. Leadership is the problem in Nigeria. We know that. But let's be positive that it's doable. Because when we had the problem of brain drain from most of your majorly medical field, I'm sure the doctors who are outside Nigeria now, if you ask them for inputs, they will be able to give you workable strategies of how to get this thing to become practicable in Nigeria. We have the resources. It's the willpower, just like you said. But let's pray that from the people we elect to lead us in the NMA, right?
Yeah.
Because it's from there that you get to choose, okay, this is who is going to be the president, who is going to be well, it's a political appointment to be a minister. But let's just start from somewhere. We can't keep talking. So take this back to your small groups and let's see how, from this little meeting we've had with Dr. Minka today, what's going to come out of it. She goes back to a group and addresses them. Then we go back to our individual groups. I'm not a medical doctor. I'm a lawyer. And that's why I'm looking at the crime aspect of it and all of that. But we need your help to help us digitalize a lot of the things we are still doing manually and things that are not even existent in the medical field. I don't know if I made any sense.
Oh, you did. Thank you. Thank you very much.
All right, I have a question. Is there any body that enforces regulations regarding medical practice as per hospital level? Not the work of doctors, but actually the operations of hospitals in Nigeria. And what does that body do? Is there like a schedule where they go around and check? Do you have that information on
Okay.
hand?
Okay, thank you for that. So we have the we have the Medical and Dental Council of Nigeria. So that has been the regulatory body. So we get our licenses issued by the Medical and Dental Council. We renew our licenses yearly. So they have been the ones that provide some sort of regulation. But in my experience so far, the most times the engagement tends to come following an adverse event. So every year we renew licenses. Nobody really, let's say, assesses if you have improved as a physician or have you attended any course over the years. We don't really have that, you know. But if there's an adverse event and somebody reports this event, or it's something that perhaps there is a legal implication and somebody wants to sue or reports to the Medical and Dental Council, then they come in and they want to audit audit the case or the event, what was done, why was this not done. We set up a panel. So to the best of my knowledge, the Medical and Dental Council is across the whole country. Then there are a few bodies that also look at the quality of the facilities that are provided. There is, I don't remember the full name. I think it's Hefama in Lagos State for one. They have, I think it's Hefama, if I'm not mistaken, that go around to inspect the health facilities and are they up to standard. And so that is also there. I don't know the frequency with which it is done, but that body exists to ensure that the facilities are also, standard. Even for the labs, we talk about ISO, that looks at the standard, that is obtained in laboratories. So what quality of tests, how valid are their results? So these bodies exist. The frequency with which they audit, I don't know. But for the Medical and Dental Council, which really oversees doctors and nurses, in my experience so far, it's if someone reports that there was some maybe negligence or malpractice, that something is done. Within the hospital, we have there's the Servicom that is focused on patient satisfaction, patient care. So Servicom is available in most most if not all public hospitals. So patients are able to give feedback on the care they received, and so that one exists as well to sort of help with collecting data or collecting information and looking at how to improve the patient experience. Thank you.
Great. There's another hand, another Dr. Ndifon. Please unmute and. You can unmute, sir.
You can unmute, Dr. Ndifon.
Hello?
Hi, we can hear you.
Oh, okay. Thank you so much. And congratulations to Dr. Minka Ndifon. Sorry, I came in late, but I'm very interested in this very recent, the latest topic that we are discussing right now. I think Nigeria's problem is population. I know Nigeria has a lot of problems, but population is a big issue. And for a very long time, we have over-centralized things. I'm speaking from Windhoek in Namibia. Namibia is just about 3.2 million people as an independent country with a president. That population is a population of some local governments in Nigeria. If we're really going to do things very well and excellently, we need to do a whole lot of decentralization. Talking about licensing individuals and facilities, it is done yearly and it is done with all the energy. So I run my own private medical practice in Windhoek, which is the capital of Namibia. I have to get the Medical or Health Professions Council license renewed yearly. Then I have to get the Ministry of Health license for the facility yearly. I also have to get renewal from the cluster, the body that manages the medical aids. Okay, there are about maybe 9 to 12 medical aid institutions that provide medical aid to Namibians, mostly in full-time employment. Then the government medical aid is overseen by the Ministry of Finance. I also have to get that approval. So I've mentioned the Health Professions Council. I have mentioned the Ministry of Health itself. I have also mentioned the Ministry of Finance and the body of all medical aids together. If you are lacking in any one of those, you are probably not going to get paid, because at the end of the day, that's the bottom line. And then in terms of professional development, a lot of drug companies that exist here, and they go everywhere, whether private facilities or government facilities, talking about their products. And when they do these products, they also organize CMEs, which have credits attached. And sometimes the renewal of your license has to do with how many credits you have accumulated. Yes. So it's easy, a small population. And I'm trying to say, whatever we do in Nigeria, let us know that by default, I know we are not the most populous country in the world, but that poses a challenge. And if we can decentralize, then we will be able to do most of the things that we are failing to do now, even better. People have quoted the USA, and they are having 51 states, including, is it Hawaii? We have 30-something states, but from what I see through the social media and all whatnot, it's like some of the states don't deserve to be called states because nothing is happening. And there was a lady who made a very important comment where she said, the people that have gone ahead with digitalization feel like they haven't done enough. And we that have not started, we are just complacent. I think something needs to change about our mindset. That is my comment. Thank you so much.
Thank you. Thank
Thank
you very
you,
much.
Dr. Ndifon. So is that senior? Are you a relative?
That's my mom.
Oh, so it's in the genes. Thank you, Senior Dr. Ndifon. All right. So do we have any more questions? Yes. We will be wrapping up by 6:30, so try and get your questions in and your comments as well.
Okay.
Okay,
So I
Usiwoma's
can
hand is
say
up.
something. Yeah, I
Okay,
just wanted
Usioma.
to.
Okay, we can't hear you. Can you turn up the volume a
Okay,
bit?
it's like a suggestion in relation to what the last two speakers said about what can we do, and also your mom having a hospital. So it's something I really like. We've talked a lot. I'm fed up of talking. I just want action. And we know politics play a role. Like we're talking of who is the NMA leader and um, the head for the national level or the head of the hospital. Like your mom just talked of what she has to do. So I think in Nigeria, if we're still having those challenges, one thing we can do is to, if possible, work on just like what she did, having your own hospital, come together with like-minded people. Because I think the willpower, it's not just the government, it's people, those who maybe they don't want to improve on themselves, but they just want the money. They're not going to be interested. But if you have like-minded people, starting point, yeah, look at building your hospital and you are giving the best that you can. You are treating patients. I think everybody will know where they are carrying their legs to, and from there we can start building up things. So that will be a challenge to you, and of course we're here to support you, and it's our country. Well done.
Thank you. Thank you.
Right. I have one more. So, as medical professionals that are in the system, if we have any grievances as non-medical people, as patients to you, what recourse do we have? Let's say we note a quality concern or
Yeah.
something that needs to be addressed. How do we make it happen? Because a concerted push needs to also come from outside and within the healthcare industry. So for us that are outside it, how do we go? What's your view on the future for that?
Thank you for that question. So for non-medical people, I think obviously these are conversations that should continue to happen, not just so at times conversations happen within the hospital. So when there's an event or an outcome, feedback, and that's for hospitals that provide avenues for feedback, because some places it may not be so easy to provide feedback, and if the healthcare professionals are able to get feedback on their system, then you expect that changes are made. On the larger scale, we have access to different forms of different means of communication. So I think it being brought to the fore people's minds, people sharing their experiences about a doctor or a patient encounter and what was done or what was not done, I think can bring that to people's consciousness. Because I believe strongly that it starts with that consciousness. If we're not even aware that there's a problem or in the way care is provided, then when we don't even think about proffering a solution. So within the hospital, I don't know where you access care, but if you enter some hospitals, they have maybe QR codes or suggestion boxes where feedback can be provided and worked upon, or just in other spaces. But I think ultimately it's us having that conversation over and over and over again. And I mean, much of the feedback we've gotten today is what we can do as the healthcare professionals to push. But that push will also come with the feedback we receive from those we are serving and those we are providing care for. Thank you.